This is the model of thoracic cavity, or you can say thorax, showing the intercostal muscles. Intercostal muscles are those muscles which lies in between the ribs, and they are 8 in number. They are arranged in 3 layers. From external to internal, it is external intercostal muscle in black color. This one is the external intercostal muscle, and this white one is the internal intercostal, and this yellow one is the innermost intercostal. So first come to external intercostal muscle. It takes origin from the lower border of the upper rib and insert on the upper border of the lower rib. And the direction of fiber is just like putting hand into the pocket of overcoat, like this. And one thing more, that towards the interchondral space, that in between the costal cartilage, it converts into a aponeurosis or membranous like structure. That's why this one is external intercostal muscle, and this is external intercostal membrane in between the costal cartilages. And its action is to elevate the ribs and helps in the inspiration, forced inspiration. It elevates the rib and help in the forced inspiration. The action of the muscle depends upon the direction of fiber. In the external intercostal muscle, the direction is of fiber. I have already stated that it is like putting hands into the overcoat pocket. So, and it lies along the axis, long axis of rib. This is rib, and the direction of fiber is along the long axis of rib. So the action is to elevate the rib. And okay. Now coming to the internal intercostal, that this one. Its origin is from the costal groove. Costal groove, here is the, on the inner aspect there is costal groove. So costal groove of the upper rib and going to the inner lip of the upper border of lower rib. Inner lip of the upper border of lower rib. One rib has got external surface, internal surface, upper border, lower border, and on the internal aspect towards the lower border there is one costal groove. Okay, and the rib has got, in its posterior most part, rib has got head, neck, tubercle, and this is the angle of the rib. Okay, now about the internal intercostal muscle, the direction of fiber is like the putting hand across the chest, like this. Okay, and towards the interchondral space, that is in between the costal cartilage, this convert into the, this is muscle. Here in the external intercostal, it convert into aponeurosis, and this is external intercostal membrane. And in the internal intercostal, this is a muscle. And in the back, near by the head and neck, head of the rib and the neck of the rib, it is membranous, and anteriorly it is muscular. Okay, so what about the action of the internal intercostal? The direction of fiber of the internal intercostal muscle is just opposite to that of the long axis of, its direction of fiber is opposite to that of long axis of rib. So it depresses the rib during forced expiration. And here in the interchondral space, the direction of fiber is along the long axis of costal cartilage. So in this part, it elevates the rib. Okay, now come to third muscle, that is the innermost intercostal, this yellow one. Here the direction of fiber is same as that of external intercostal, that is the putting hand into the overcoat pocket. So its action is elevate the rib during the forced inspiration. This is shown the black, yellow and black, white and yellow, just showing that this is the external one, this is middle layer and this is internal layer. In the internal aspect, they are anteriorly Sternocostalis. In the middle, it is innermost intercostal and posteriorly subcostalis muscle. Okay. Now we have learned external intercostal, internal intercostal and innermost intercostal. Now come to fourth muscle, that is Sternocostalis. This is our Sternocostalis muscle. It takes origin from the lower 1/3 of the sternum. Lower 1/3 of a sternum and insert on at the level of the costal cartilage of second to fifth rib at the level of the costal cartilage. Okay, and its lowermost fiber is almost horizontal and its action is to depress the rib. Okay, now this is the fourth one, and now fifth one is this is in orange color. This one is the subcostalis muscle. Subcostalis muscle is at the level of angle of the rib. It starts from the upper rib and going to the below 2 to 3 ribs at the level of angle. Okay, so this is subcostalis and its action is to elevate the rib. Now this is in green color. This is levator costarum. It originates from the tip of the transverse process from T1 to T11 all throughout. I have made only 3, but it is from T1 to T11 and it insert just one rib below. Okay, it starts from the tip of the transverse process. This is levator costarum. As the name itself says, its action is to elevate the rib. Now coming to this is Serratus posterior superior. It starts from the C6 level. This is the T1. From the C6 up to the T2. From C6 to T2, and it runs caudally and laterally and goes it is C6 to T2, and here it is T2 to T5. You can say second to fifth rib. It is going caudally and laterally. And here is the Serratus posterior inferior. Both lies on the exterior aspect in the back. Okay, Serratus posterior inferior. It starts from the the tip of this hole, this serratus posterior, superior, inferior, both starts from the tip of the spinous process. This is from C6 to T2, and here is the, it is from the T11 to L2. T11 to L2, and it goes cranially and laterally, and insert in the T5 to T8, just 5th to 8th rib. Okay, and the action of serratus posterior superior is to elevate the rib, and this is depresses the rib. Okay, so this is all intercostal muscle. And what is the clinical significance? There are some things, some facts which has to remember, that the intercostal nerve is the ventral rami of their respective spinal segment. Okay, and intercostal, if there is intercostal neuralgia, we have to block the intercostal nerve, and to block the intercostal nerve we have to give anesthetic injection towards is head and neck of rib, just before it gives collateral branches. The intercostal nerve give one collateral branch. If we give injection nearby the angle, then collateral branch, only the intercostal nerve will get anesthetized and collateral branch will radiate pain. So we have to give near the head neck part, okay, before the collateral branch arises from the intercostal nerve. Okay, this is one thing. And the costal groove on the internal aspect of a rib towards its lower border, there is one costal groove in which vein structure lies from superior to inferior. This is intercostal vein, then intercostal artery, and then intercostal nerve. Okay, so this is all about the intercostal muscles. Thank you.